Before we get started on the dissection, there are a few bony landmarks that you should palpate both on the body and even on yourself. And these are the clavicles, and then in between the clavicles at the top of the sternum there's an area that we refer to as the sternal notch. You can run your finger down the body of the sternum and then palpate this end cartilage, which is called the xiphoid process. On the cadaver you should also mark the margin of the rib cage, which is shown here. And then finally, in the area of the pelvis, there are two sharp bony prominences, which are called the anterior superior iliac spines. In looking at the body, we've now marked those bony landmarks that we just looked at in the skeleton. Here are the clavicles here, and then this area in between the clavicles you should be able to palpate. This would be the sternal notch. Our first incision is going to extend from the sternal notch along the body of the sternum down to the xiphoid process, which is marked right here. Here are the margin of the ribs going on either side. The incision will be extended distally towards the umbilicus, and then we'll make an incision around the umbilicus down to a line that connects the two anterior superior iliac spines, which are shown here and here. The initial incision that you should try runs down along the body of the manubrium of the sternum, and you can cut actually quite deeply here because the bone will protect you from going any further, and will show you the layers that you will encounter. Beyond this point you have to be much more careful, of course, because you don't want to go into the abdominal cavity. Now we've made our first incision from the sternal notch down to the xiphoid, and we literally have cut right down to the bone. And this is an indication of the various layers that you should note. First of all, we're going to have the epidermis and the dermis, which would be this whitish layer right here, and beneath that is a layer that we refer to as the subcutaneous fascia. It's filled mostly with fat and connective tissue, and it extends from the skin all the way down to a dense fascial layer which covers the muscle. This is the superficial fascia. So that as you extend your incision below the xiphoid process, you want to make sure that you're not cutting any deeper than this layer right here. And of course this layer will vary according to the obesity of the cadaver. In this particular cadaver you can see that the amount of fat has remained about the same. So below the xiphoid we do not want to enter the abdominal cavity, so do not cut any deeper than the initial indication that you have here. We've extended the incision from our initial one over the sternum down the midline on the anterior abdominal wall, and we've also done another mid-clavicular incision also going distally. And this allows us to now separate some of the flaps of skin. And in doing so, what we are going to see, or what you should look for, are small cutaneous nerves that are extending through the deep fascia covering the muscle, coming to the skin and traversing that superficial fascial space that I mentioned before. Okay? So here is one, and you will see, you won't be able to see them all, but you should be able to see on a regular basis in a segmental fashion these nerves are extending through the deep fascia to get to the skin. These are cutaneous nerves which will be innervating both the superficial compartment and the skin. On the lateral flaps you will notice also branches of the same nerves. These are called lateral cutaneous nerves, and in this specimen it is seen how beautifully regular they are in their appearance as they come through the deep fascia. It's not necessary to find all of these, but find several examples of these. The body's been turned over, and we've made an incision along the midline over the spinous processes of the vertebra from the nape of the neck down to the sacral region. And then we made about 6 transverse cuts that you can see here. And this allows us to now strip away the skin in this fashion. And again, we're able to pick up now posterior cutaneous nerves. Here's one here, and here's another one here. Here's the matching one on the other side for this one. It was cut just a stump, so you'll be finding just a lot of stumps, not necessarily the connections, but we can still identify them, again looking for the vessel that accompanies the nerve. So in this case we have one here, and then we can follow down. You can also see in a very regular fashion these nerves are emerging from the investing fascia of the muscles and traversing the superficial fascia to go to the skin. And another one down here. The next step in the dissection is to look for some of the superficial lymph nodes. We're going to look in the inguinal region, and I've just cut down through here and here to the skin, and am just dissecting away some of the superficial tissue. And then I'm just going to take my scalpel blade and stroke fairly vigorously in the inguinal region. And one of the things that you're going to look for is on the medial aspect. This is a male, so it's just on the lateral side of the scrotum. You're going to pick up this large saphenous vein coming up from the leg. And usually just on the lateral side of it you'll find some lymph nodes, and I think you can see right here. Here's one right here. They're usually about the size of a pea or larger. They have the same color as the fat, but when you palpate them they feel a little bit firmer. And here's another one right here which is quite large. And when you just stroke on the inferior aspect of the node, you will see that there will be lots of small strands attached to it. These are just multiple lymphatic channels coming into the inferior aspect of the node, and then there will be fewer coming out the top, usually a larger one. Here's a large lymphatic vessel right here. Now, these are actually quite large, and they were very easy to find in this specimen, so that they may not always be as evident. They will be, in many cases, much smaller than this. So these were very easy to find. We would characterize these as being a bit enlarged because they are so easy to find.